So I just like to start out by seeing how it's going. You're in your capstone class. Congratulations. That's a huge deal. So proud of you. And I know that you've had several weeks now to work on the RHIA quizzes. So I know sometimes students tend to panic that they're not remembering everything. That's okay. We're not expecting you to remember everything, but how are you finding it so far?
It's good. I do feel like, ooh, there's a lot of information, and I'm like, whew, I have to know all of this stuff. And I'm like, but I know I'll get it. The more I see it, the better it's going to be.
Yeah,
I'd
absolutely.
rather see all that and be, than like think that I'd be overconfident and be like, oh, I can handle all this.
Right. Yeah. No, it's a process, and it's taking, 2 to 4 years, however long you've been in the program, and everything you've learned. And, there's some stuff that you may have learned early on that you don't remember, or you don't even think you learned, but it's all on these quizzes, and you may get, some of the same similar questions. There may be different ones, but the intent with this capstone is just to help you practice answering the questions, seeing them in the multiple choice format that will be similar to what you'll see on the actual exam. So it's really to give you practice.
Nice.
Hello.
And I know, oh, hello. Yes.
Yeah.
Hi, Anna.
So the questions that are on the practice test, are those similar to what we would take on the actual RHIA test?
Yeah, I can't guarantee they'll be the same, but they're similar concepts. They're written similarly. A lot of the questions on the exam are scenario based. Like they might give you a paragraph and then you have to select the best answer. And I always recommend going by process of elimination, eliminate the answers that you know right off the bat that are not the right ones. And then if there are two you're not sure of, study those carefully and then pick the best one. Try not to second guess yourself. Stick with your gut, and that's usually the right one.
Okay, thank you.
Hey, what about the codes?
The codes, yeah, I get that a lot. Some students think, how can I memorize all of these? And there's no way humanly possible that anyone can memorize all those codes. And you're not even allowed to take a code book to the test with you. So it's more about recognizing the coding conventions and being able to look at that paragraph, that scenario, and pick out the best code. And there are not a ton of coding questions on the RHIA, maybe 8 to 12. So I wouldn't stress, obviously practice, the more you practice, the better, but this isn't a coding credential where you would see a lot more coding questions.
I'm sorry. Did you say we cannot, or can we take our coding book?
No, they're not allowed.
Really? Oh,
yeah.
No.
Yeah.
Now I'm paranoid. There's no way I'm gonna, without the actual examples, there's no way I'm gonna get it.
No, just keep practicing. And yes. Oh, yeah, just
I just said the same. It's like without the book there to look it up, it's like, oh God.
Yeah, it's I know when I took the RHIT, we were allowed to bring our code books. The RHIA, I was not, but there weren't a ton of questions. Like the CCS, you would have a lot more coding questions, and I believe that one you can bring a coding book. The nice thing, I don't know when AHIMA is rolling this out, but they are going to be offering remote proctoring. In the past, you had to find a Pearson VUE testing site and go there. Some students had to travel quite a ways, but they are rolling out remote proctoring at some point. So be on the lookout for that. So that will help alleviate some of that anxiety. I know myself, when I went to the testing site, you have to empty out all your pockets and you're in this empty room, and it's quite intimidating.
I'm a little intimidated by the the pass rate for like first time testers.
Mm.
I should never have looked at that, I don't think, but like 64% in 2023, that's a low percentage.
Yeah, yeah, it is increasing. COVID, I think, had a big impact. But AHIMA has been doing a lot to try to increase that. So hopefully the trend will be up. Our rates are improving as well. So I think that the pandemic really did a number on folks.
What books you suggest? Because I'm going to go do my CPC, and I have a lot of practice testing and stuff on that. But what would you recommend for practicing before taking the tests?
For the RHIA or the CPC?
The RHIA.
Yeah, I would definitely pull out is it Merida Johns, the big fat health information management principles. That one has a lot of check your understanding questions at the end of each chapter. I would definitely pull that one out and read it from front to back if you can. I know it's not light reading, but that one is a really good one to practice, highlight. Yes, it's the big one. Yeah.
The big one, yes, I have.
You should have had it in multiple courses.
Yes, I have it. So I'm planning to read this whole book again.
Okay. And what I did when I was studying is I created flashcards. I would write the question on one side and then the answer on the back. And then everywhere I went, doctor's appointments, waiting for the kids, on the boat even, I had my flashcards and I was constantly quizzing myself, and that was super helpful. I also recorded myself asking myself the questions. So these are just tips I use to study for both the RHIT and then the RHIA.
And the RHIT is easier, right, than the A, right?
The RHIT is for 2-year programs, so I guess you could call it easier. I don't know.
Okay. I'm going to look on Amazon as well for any practice.
Yeah, AHIMA has their own RHIA review guide as well. And you will have access to the one that's built into your course for up to a year after you graduate. So you can always go back and take those practice tests again.
Oh, okay. I'll try to take those tests with the coding questions without the book and see how I do without the book.
How are you doing with the book?
Good. Great.
Yeah, good.
I mean, I'll get a couple wrong here and there, but the book does help.
Yeah, but that's half the battle. If you're getting them right with the book, then you know the guidelines because you're having to decipher those. So I would bet you'd do better than you think.
I get nervous with the I did take the CPC 10 years ago, and I failed by 3 points. No, 2 points. Because my anxiety is really bad, so they kept announcing like you have 10 minutes, you have 5 minutes, you have 4. So I completely freaked out, and I said, okay, I'm done.
Yeah, that would be nerve-wracking for sure.
So I don't want to go through that again.
No.
And I was here in Connecticut. I went to UConn, the college, and it was a room full of people, and there were 2 people beside me, and one person just like munching away on their chips.
Oh,
it was very nerve-wracking.
Oh, so no, they didn't allow. They don't allow you to bring anything in, so you wouldn't have that.
I'm gonna do it at home, so
yeah,
it works out better.
Yeah, definitely. Well, I do have a. Oh, go ahead.
They probably wouldn't even let you bring in like noise canceling headphones, I'm assuming, because they would think that you're hearing something, right?
Yeah, no, they're pretty strict.
Yeah.
Maybe not as strict. I have a friend whose son had to do his, is it NCLEP? the exam to get into medical school, and that was really brutal. Yeah, I think you have someone watching you the whole time.
That'd be nerve-wracking.
Yeah, yeah. Well, I do have a little Jeopardy game that we can play. Since there are 4 of you, it might be fun. I can pull it up on the screen, and then it's basically just review questions for we can do domain 1, and I will show the question, and then you can attempt to answer, and it's okay if you don't have the answer. I will flip these are the different categories: external forces, health record, data standards, data reporting, and data structures. And then someone just picks external forces for 100. And then I will flip the card to show the question, and then someone can attempt to answer, and then I'll show you the answer. And it's okay if no one has the answer. This is just for fun to practice. So we'll start with you, Anna. You can select a category with a dollar amount, and we'll go from there.
Oh no. Health records for 100.
Okay, let's see. One record documentation requirement shared by both acute care and emergency departments.
Ooh.
Oh, it's not even multiple choice.
No, that probably. And it's okay if you don't have it. I can just go through. Oops, it didn't work the way it was supposed to. Let's see. Oh, there we go. Patient's condition on discharge.
Okay.
All right, Christina. Oh, and it didn't. It's supposed to
Cross off.
Erase it when I call it off. Okay, well, I'm still perfecting this. So let's see, Christina, what would you like?
I'll do external forces for 100.
Okay. Your organization's medical staff rules and regulations require that physicians complete all health record documentation within 30 days of discharge. If the documentation is not completed within 30 days, then the record is considered okay.
30 days, and the record is considered incomplete. It's not completed, is it?
Yeah, it's that, but there's a specific word for it. Delinquent.
Okay.
Yeah. All right. How about is it Marilyn? You want to go next?
Okay, which one was the last one?
Yeah. External forces for 100, I think, is the last one we did.
Data standards for 100.
Okay, let's see. In an acute care hospital, a complete history and physical may not be required for a new admission when
An acute care hospital.
The patient has already seen the doctor within 2 weeks.
let's see. Legible copy of a current H&P performed in the attending physician's office is available. So you were definitely on the right track. Good job. All right, and let's see. Taylor, would you like to go next?
Yeah, I'm a little scared, but I'll
Nothing.
do health record for 200 if we already did the 100.
Yeah, we did. Okay, let's see. Which organizational document defines who can document within the health record, the type of documentation that can occur, and the timeliness and completeness of the documentation within the organization's health record? So what, like policy, what document would define all of this?
Legal.
The what?
Would it be legal? No.
Yeah, there's an official name for it. And when you see it, you'll be like, oh, yeah, that's right.
Can't think of Oh.
The bylaws, yeah.
This is harder than I
That's-
thought it would be.
That's okay. That's why you're here. The more you see these questions, the better off.
Yeah, that's
All right. Let's see. Back to Anna. And if you can't remember which ones we did, I can just flip them and see.
Data reporting 400.
Okay. A cancer program is surveyed for approval by the
Cancer programs.
what?
I'm reading it to myself so I can.
Oh, okay. No problem.
Is it Cancer Registry?
Okay. Yeah, American Cancer Society. But you're right. They do have like your hospital would have a cancer registry, and you follow the guidelines by the American Cancer Society. Okay, Christina, you're up.
Let's see. Have we done data structures for 100? Or did I do that last time? No.
No, we have not. The name of the root operation in ICD-10 PCFs that describes cutting out or off without replacement all of a body part is.
This is like my worst one, root operations. This is why you do flashcards, obviously. Excision.
Okay, let's see.
I don't know. What E-word? Oh,
Resection.
Okay.
Yeah. Close.
I always get that. It's not accession? I get those.
There's two that I get confused too, or like they're so close.
Which one was that? Data structures.
Yeah.
Yeah. Describes cutting out or off without replacement. Yeah, I could see how that one could be tricky. All right, who is up next? Was it Maryland? Or did you just go?
I haven't gone yet. Well,
Okay.
This is my second time.
Okay.
Did we do data reporting 100 yet?
I think so. Let's see. Yeah, we did.
Okay, data reporting 200.
Okay. You have been asked to identify every reportable case of cancer from the previous year. A key resource will be the facilities. I think we might have heard it earlier.
Registry?
Yeah.
The cancer registry.
Oh, no, disease index.
Oh.
Yeah.
Oh.
But good guess. All right, and Taylor.
Could I do data standards for, I think 300 is next?
Okay. Oh boy, this is a long one. In the computerization of forms, good screen view design, along with the options of alerts and alarms, makes it easier to ensure that all essential data items have been captured. One essential item to be captured on the physical exam is the.
I think I might be thinking of this incorrectly, but I want to say the formatting.
That's okay. Anyone else have a guess? All right. General appearance as assessed by the physician. Yeah, I don't think I would have gotten that one either. All right, back to Anna.
Health record for 400. Did we do 300 already?
I don't think so. Let's see. Qualitative analysis of OB records reveals a pattern of inconsistent data entries when comparing documentation of the same data elements captured on both the prenatal form and labor and delivery form. The characteristic of data quality that is being compromised in the case is data
I I'm gonna say I don't know because I don't even remember this question anywhere.
Is it integrity?
Okay, yeah, you're definitely on the right track.
The main
Oops,
one answer.
that's not right, but it is data integrity. We have
Oh,
an
data integrity.
issue with that question. All right, let's see. Christina, I think it's you.
I'll do the next external forces. Was it 300?
Patient's heart is being monitored while he is at home. This is known as
this is so easy. I don't even know why my brain is not. You're being like monitored. What are we monitored? Can you give me a hint? What's the first letter?
Can I do a guess?
What do you make a phone? What do you make a call on?
Phone?
What's the first part of that word?
Like
It's telehealth.
Telehealth. I was trying to say telephone. Yeah, telehealth. All right. And Taylor, I think we're up to you.
Could I do, what was the one we just did? Was that health or external forces?
Yeah.
Could I do the next one of that?
Let's see. Healthcare facility has decided to destroy computerized data. AHIMA recommendations identify which of the following methods as the preferred method of destruction for computerized data.
Would it be degaussing?
Okay, let's see. Good job. Excellent.
Yeah.
All right, let's do a couple more. Anna.
Data reporting for 300.
All right, as the director of the Health Information Technology Program, you are reviewing the workforce development forecast for electronic health records specialists as outlined by ARRA and High Tech. To keep abreast of changes in this program, you will need to regularly access the website of which governmental agency? That was a mouthful.
That I know this.
And it's a good idea to bookmark that website once we find out which one.
Okay, so the terrible.
I'll give you a hint. It starts with Office of.
It's OIG. No. OSHA.
Let's see.
Is it Office of
the National Court, the ONC. Yeah, you were in the right vicinity.
I was like, I know this one.
And I know you're on the spot here. Let's see, Christina.
My turn again already, huh? Let's just do data structures again. I think we're on, is it 200 or 300? Can't remember.
I think 300. Parker has type 1 diabetes with hypertension, currently controlled with medication. Admitted through the ER for an emergency appendectomy. Following surgery, the patient developed an infection at the wound site that was treated with antibiotics. When making decisions about sequencing the codes for this case, the coder should rely on definitions found in the.
I don't know.
Anyone else?
Anyone else?
CPT?
The what?
The CPT? Oh.
the universe, health diagnosis, something. But yeah. And this is an example of the type of coding question you might see where you're not needing to know a code, but you're needing to know about the coding and the different coding conventions and guidelines. And let's see, we have a few minutes left. Who's up next? Is it Marilyn? Or did you just go?
I haven't gone.
Okay.
Data structures, did we do 400 yet?
Level 2 national codes, also known as HCPCS, is maintained by
AMA
Centers,
or CMS.
Centers of,
CMS.
yeah,
Yeah.
CMS.
Good job. All right. And let's see, Taylor, one more for you, and then we'll call it a night.
Could I do external forces for 5, I think?
Okay. The Healthcare Costs and Utilization Project consists of a set of databases that include data on inpatients whose care is paid for by third-party payers. This is an initiative of what?
I have no clue on that.
Okay, anyone else? All right, Agency for Healthcare Research and Quality.
Got it.
All
Thank
right,
you.
how did you find this? Was this fun, helpful? Would you like to attend another one?
Yes, I think it was really helpful.
I would like multiple choice.
Yeah, well, we'd have to redo our Jeopardy game, but maybe we can do that.
Is this the type of stuff
Yeah,
that
this
we
was
made
fun.
like a
Okay.
Let's do this again.
All
With
right,
multiple
and
questions, with multiple questions where you have to put multiple answers. Because I think our brains are just like recording, remembering. If you see the word, you remember it.
right,
Yes.
yeah.
Yes, exactly.
And you
Yeah,
can
and I'm
eliminate
not
ones
sure-
that you're like, that wouldn't work, that's not a good one. You can kind of eliminate and figure out,
Right, yeah, definitely helps. Yeah, and I'm not sure if you heard, but our master's degree in HIM just achieved KHIM accreditation. So we'll have students in that capstone studying for the exam as well. So I'll invite them. So hopefully we have a bigger crowd at some point, but it'd be fun. And I'm even thinking of some little prizes, but we'll see. All right, well, thank you so much for joining, and I want to wish you a good rest of your evening, and we'll be in touch.
Thank you.
Thank you so much.
Thank you for
Thank
this.
you.
Have a good night.
You too. Bye-bye.